see these sessions later.
Thank you, Helen. So just to give a little bit of an outline of the next 45 minutes, we thought we would use this opportunity today to just feed back to you a little bit about the Peer Support Worker Roadshow, because we are aware that not everybody could attend. There is a report which is available, so you're very welcome, to have a look at that. That is also on the Trust website. But we also thought, recognizing everybody's demands, it's maybe a nice opportunity just to summarize what has happened. So just to start off with kind of the Peer Support Worker Roadshow. There were 26 people who attended. That included service users, staff from engagement team, human resources, training department, occupational therapy, people from listening into action, the chief executive, and also practitioners with lived experience. So over the next 20 minutes, we'll use this time to hear a little bit more from Helen and Rachel about their roles in their services. That is the North Recovery Team and the Gender Identity Service. And then that will be followed by Laura reporting about the themes that came out from the 2 discussion groups that were part of the roadshow. And then we will kind of summarize what happened since, or what has happened since. And after that, open up for discussion, comments, and any questions. So I'll hand over to you, Rachel, to start off with giving us a little bit more information about peer support at North Recovery.
Yeah, hello everyone. Thank you very much for kind of attending this meeting. And just a disclaimer, my puppy's decided to just go mad. So yeah, if you can hear squeaking and mad things in the background, then that's that. But yeah, I'm a peer worker at North Recovery Community Mental Health Services, and as you can kind of see on screen, this is a process map that I kind of made of, just my role really, and how people kind of come to me, and then how my sessions kind of go with people. So yeah, I kind of do one-to-one sessions with people mainly. There's another lady who kind of works with me at North Recovery called Tracy, but she can't be here today. So yeah, we kind of get referred people mainly through kind of care coordinators. And yeah, we kind of do one-to-one work on emotional sensitivity and kind of educating, just around someone's diagnosis, kind of, and teach them like DBT skills and stuff like that. Yeah, and it's a really, really good, interesting role. And a lot of the time I kind of use my own experience as well of having kind of mental difficulties to talk to people about kind of what's worked for me, whilst also recognizing, that they're different people. Oh, that's Daisy in the background. And yeah, it's really good. It tends to be about like 12 to 16 appointments that people have, kind of working through something called the Understanding Emotional Sensitivity Workbook. And yeah, that's that really. I hope I've covered it.
Thank you very much, Rachel. In true style homeworking, isn't it, with Daisy in the background? So yeah. Helen, would you like to come in now and talk a little bit more about your role at Gender Identity?
Yes, thank you, Kirk. And I wanted Daisy as well in the background, but unfortunately I don't have any pets apart from the odd spider that crawls out from somewhere now and again. But yeah, so my role as a peer support worker in the clinic, all of my referrals come through the clinic, so I don't see anybody outside of the clinic. All my work is one-to-one. I tend to do my work actually out in the community. normally when we've not got a pandemic going on. At the moment, I'm mainly working by Attend Anywhere to work with people on a one-to-one basis. Originally, I started off within the Rotherham and Sheffield area, then expanded it out to cover the whole of South Yorkshire. And now, with the advent of Attend Anywhere, I'm able to help people from anywhere within England. So just to put a little bit of background on that, the Portbrook service, or the Gender Identity Service, because it's one of a limited number of services, and we're commissioned through NHS England, we can take referrals from anywhere within England. So as a consequence, I can also see people from anywhere within England, and Attend Anywhere definitely makes that. Well, easier. So yeah, that's. Hello.
Thank you very much, Helen. You did freeze for me. That's why, sorry if there's a bit of a delay in my response.
Right.
Thank you. So to move on from there, just to talk a little bit more about the survey, just to give a very quick summary. So working very closely with Sue Sibbald, as you can see there, getting recognition, well-deserved recognition for all her hard work. So it was an honor to work with Sue, to draw on her knowledge and experience, as well as Laura Dibona. And so when working with the peer support workers, with Sue and Laura, we joined the LIA 7 Steps initiative, and myself, I brought the QI tools, quality improvement tools, to it. And we kind of decided that actually doing a survey in order to get some baselines would be beneficial, because what we did identify that there are some inconsistencies in terms of recruitment, induction, supervision, roles and responsibilities. And so it felt, in order to really find out what everybody's understanding of peer support is in the trust, it would be useful to do a trust-wide survey. And so people from across the trust took part in the survey. We had a 64 response rate. And what it really highlighted is that really we kind of are working towards a shared understanding with regards what the roles and responsibilities are, what the boundaries of peer support workers are with regards to, for example, working to psychiatric models or being pulled into existing roles. Also that understanding of are peer support workers involved in developing services as well as recruitment, that understanding whether, you know, peer support workers do bring their lived experience to their role. And also the kind of understanding in terms of what is a peer support worker's role in a multidisciplinary team. And the idea of a survey was very much to bring curiosity to where people are at, and kind of not making assumption what we think or hope. And so it's been very useful, because the response really identified that whereas there's some understanding, there's still a way to go and some work to do. So I'm going to hand over now to Laura.
Thanks, Gurka. So I'm Laura Dibona, so I work in the engagement and experience team. So my job generally is to help the trust integrate learning from people who have experience of using services or ill health to improve the work of the trust, and specifically improving the outcomes and experiences of the people who use our services. So what I would ask you to be thinking about really is how do you do that? I can't see who's on the call from where I'm sat. So if you work in a team, how are you doing that now? Would you like any support from the engagement and experience team? If you're someone who's using services, again, you can get in touch and what can we do to make sure that we are doing everything we can to learn from your experiences. But specifically today, obviously the focus is peer support. And the presentation I gave at the Roadshow was really around the evidence and policy background to the whole peer support agenda. So I'm going to pull out 4 key themes from national and international evidence and policy relating to peer support. So the first one is, and really I guess these are all reasons why you might want to consider employing a peer worker in your team or accessing peer support if you're able to. So the first one is that we know that peer support tells us that people who have lived experience have unique insights that can complement all professional understandings of care. So if you work with a peer worker, it can really help to improve service user outcomes and experiences in a way that other professional care doesn't. We also know that as a trust, by employing peer workers, that having those insights, that reminder about the lived experience perspective in everything we do, can help NHS trusts improve their culture, so to make us more person-centred, more compassionate and recovery focused. We also know that by employing people into peer worker roles, it offers an opportunity for those people who've been through services or not been through services but been unwell to, so it's like the next step can be a step in people's recovery to see the good that they've learned from what they've had to go through, and to share that could be beneficial to themselves. So that helps our service users in a more general sense. And the fourth reason is the policy. So just to be clear that peer support is a national priority agenda item now. So specifically it's mentioned within the 5-year forward view for mental health, the NHS long-term plan and the NHS people plan, as well as a lot of World Health Authority strategy documents. So peer support is here to stay, and that national and international work is filtering down into the trust now. So it is within the trust strategies. It's been part of the service user engagement strategy for 4 or 5 years now to be employing peer workers, and it's now infiltrated the people strategy, and hopefully it will go into the organisational development strategy and the wider trust strategy. Now, so that's it for my presentation. Gurkil, did you want me to go straight into the themes that came out of the Roadshow?
Yes, please, Laura, if you could.
Yeah, so so if you get a chance to look at the report, it is very long. We deliberately kept everything in to make it really detailed, knowing that a lot of people wouldn't read the whole thing, but it's there for the few people who might want to.
Laura?
Yes.
Sorry to interrupt. Just to include a comment, Karen Dickinson just highlighted that, of course, it's also key objective in the SHSC people plan.
Yes. Sorry, I thought I'd said that, but yes, it is within the SHSC people plan, is to employ peer workers and also to increase, I think it's the term, the HR term is onboarding of peer workers, which basically means getting the whole trust to approach, accept and use this approach, to have everyone on board with it. Thank you. So the themes, there were 4 themes, and these kind of reflect, I guess, what all of us have said already today over the last 20 minutes. The 4 themes that came out of everyone's discussions at the Roadshow, so not just the presenters, but everyone who contributed. The first one was around the progression, the development and the training of people in peer worker roles. So acknowledgement that there's some inconsistencies there within the trust and some work to be done to address those issues. The second one was around the recruitment to peer worker roles. Again, issues around inconsistency and support. So we are here to offer support to any services who are thinking of employing peer workers. The third one was gaining some shared understanding of what peer worker role is. We acknowledge, as you will have seen from Rachel and Helen's presentations, that the role can be quite different in different teams, but there is some commonality and shared understanding around that. And the fourth one was around organisational culture, and that is it goes both ways. So it's saying that we need to have an organisational culture that enables peer workers to thrive and enables us to make the most of peer workers. But then by employing peer workers, they will help us as a trust make that culture better. So it's kind of a cycle. So it works both ways. So those were the themes from the report. I'm just wondering, is there another slide? Do I need to be moving on? My mouse is frozen. No. That's the last slide. Did you want me to start talking about work gone forward, Gurka, or should we open up for everyone to talk about some of the progress that we've made since the roadshow?
I wondered whether it would be quite nice to open it up, but obviously do start off by all means, Laura, but also Helen and Rachel, please do join in kind of sharing now what we've achieved so far and the pieces of work we've engaged in since the Peer Support Worker Roadshow.
Yeah, I'm just wondering whether Gurk, I think we missed out, what it is that we consider a peer worker to be, and some of the, what encompasses a peer support worker. I know Laura's touched on it, but I just wonder whether it would be handy to just recap on that.
If you like to, Helen, go for it.
Yeah, so I think from the report, we come up with what a peer support worker is, and we kind of said a peer worker or peer support worker is someone with lived experience who can help others with similar conditions to live a fulfilled life by using their experience to help and guide people in their own personal recovery. The most of the available services open to them, peer workers provide peer support found in a set of is kind of what we said a peer worker is. And so what encompasses a peer worker is peer workers have a unique perspective of things gained through living with a diagnosis, and then working with a specialist team. We also have a professionalism within the peer support worker role, and again there's a trust, mutuality and reciprocity between peer support workers and the person we're supporting, that leads to better engagement all around. A peer support worker should be embedded peer support worker role within a team. We also work to the same confidentiality as any other staff member, and we're also there a little bit to challenge the norm within a team where it's required to hopefully gain better ways of working, as well as advocating and encouraging people to have the control of their own care, and liaising with other agencies involved with the persons we are working with, carrying out interventions that are specific to our role. As part of that, we should be attending multidisciplinary team meetings and all discussions where it's required.
Lovely, thank you, Helen. Laura, would you like to make a start with regards to action so far?
Yeah, so I'll make a start. So there's been a lot of work with human resources and with the training teams. So as Karen pointed out, peer support work is now part of the people strategy for the trust, people plan. And we've done lots of work with human resources. There's still quite a lot more to do, but around addressing those issues of why are there, for instance, different bandings of peer workers? How do we make sure that there is some commonality within the job descriptions for peer support workers? How do we flag when a team is considering putting a job out to advert for a peer worker? How do we make sure that that team is knowledgeable about peer support and linked in with us? So we've been having lots of discussions to try and get those processes in place to make sure that there's so much skill and knowledge around peer support within the organisation. So it's really just about how we share that. We've also been going out to team, well, not going out, but online talking to different teams about the peer worker role, so people can make an informed decision on whether or not it's right for them, and whether it's like an additional post or whether it's making some changes within the makeup of their current MDT to allow peer worker. And Rachel and Helen, I think you have both done some videos to just describe the peer worker role, so to develop a bank of resources really, so that it's really easy for anyone who's considering finding out more about peer support to do that. I think there's some of the things.
Yes.
More,
so also the other thing with regards to, so we've touched on, you know, the role, responsibility, banding. But we also did the kind of benchmarking exercise in the sense of we were very lucky that Emma Watson from Nottinghamshire joined us for a meeting where we really kind of just could draw on their learning, because they've been employing peer support workers since, is it 2010? Is that correct, Laura?
Yeah.
And they actually now have 55 peer support workers in place and have a very clear structure and processes. And obviously every context is different, but equally there's a lot of learning we can do from their experiences. So how they have encountered also maybe challenges that we can now, you know, we can listen to them, what has worked and what may be worth looking at for us as a trust. So that was really beneficial. And also, Laura, because you linked in with organizational development as well, didn't you? Could you say a little bit more about that?
Yes. So because organizational culture is such a big issue so historically it has been for peer workers. Sadly, it's not always gone well within this trust, and it's often been around the organizational culture not really supporting the peer worker role. So yes, Rita Evans has been really welcoming of discussions to try and make sure that within the new organisational development strategy, that the needs of the peer workers are very much addressed, to make sure, so again, and it's both ways, to make sure that we are developing a culture that supports peer working, that recognises that that experience, that lived experience, is really beneficial to care, but also finds a way in which so the culture supports peer working, but also so that peer workers have influence within the organisation. So we don't know quite what that's going to look like yet, but to make sure that we're really maximising the learning from, you know, we don't have many peer workers in our trust yet. We have 6, and so it's to maximise the learning, because Rachel and Helen, I think you get pulled in lots of different directions, and often people want you to sit on meetings and contribute to different projects. So it's just trying to find ways in which we can really embed the learning that you offer to the trust across the organisation.
There's a question in the chat, Laura. Is there any update on the Trailblazer application?
So the Trailblazer application,
Joe,
if you don't know, so Health Education England put out I don't know the words for these, put out a tender to say, does anybody want to trailblaze the new peer support national competency framework within their organisation? So the National Competency Framework for Peer Support has been developed, it's been led by University College of London, but various people who we are linked to have contributed to that. It was produced and it came out earlier in the year, and it was widely condemned. So it went out to consultation, and it was due for publication at the end of September. I looked yesterday, it's still not been published, the revised competency framework, but we put in a bid to trial it and training our peer workers and our peer worker supervisors in the new competency framework. We were due to have found out at the end of September whether or not we were successful. We still haven't found out. Again, I was in discussion with Health Education England yesterday, and they told me they would let me know very soon the outcome of that. So no, we don't know the outcome is the shorter way, but very soon, hopefully. And we are in discussions about putting in a bid to do more training around the competency framework, but we don't know yet whether or not the trust is going to go ahead with that. I don't know if Karen's on the call, whether she has an update on that.
Well, it's two separate things, isn't it? Obviously, the Trailblazer, we've put the expression of interest in. I think it's important to note, and the term Trailblazer is used in association with apprenticeships. And I know nationally there was a proposal for a peer support worker apprenticeship that had a lot of problems and didn't go ahead. They appear to have used the term Trailblazer for this pilot of the National Competency Framework, but I just want to clarify it's not an apprenticeship standard or a Trailblazer associated with an apprenticeship. In relation to the 10, they're linked. The National Training Competency Framework, they want to pilot, and we've said that we'll pilot it. They then want people to provide the training across the 4 or 5 Health Education England regions. So that is a tender to be a training provider, to provide training not only to our own peer support workers, but to a wider, much wider group of people. So it's a completely different thing. So what the trust needs to establish is whether it wants to act in the capacity of an external training provider. Whether we do or we don't won't detract from our commitment to put our own peer support workers through that training, because that will be the national standard. And I think it's important to sort of note that difference, because being a training provider is obviously very different to being a health and social care provider, and it would be more like being a further education college or something like that. So that's the bit. The second bit, what the execs are talking about it, hopefully as we speak. I'm pushing for a response.
Thank you, Karen. And just to say on that training as well, that was really clear and helpful. So within this competency framework, the idea is that all peer support workers, supervisors, will also get some training in it. So that's to address the issue that we've talked about, that's a national issue around the lack of clarity around the peer worker role. So often historically what's happened in these new posts, and it's often the same with any new role when you introduce it to the NHS, so the person coming in to do the role has quite different expectations to the person who's supervising, and that again may be different to the person who decided it was a good idea to recruit a peer worker. So that's where some of the challenges have come from historically, and there is work at a national level as well as a local level to address that, to make sure that everyone's got the same message around what a peer worker does.
Great, thank you. I wonder at this point maybe nice to stop sharing and all come together in a room, so to speak, and open up to the group for kind of comments, questions. So I can see Joe Hemmingfield, you've got your hand up. Would you like to go?
Hi, thank you, Gurka. It's really interesting to hear how this work's been developing. And I suppose I'd always thought I probably was a peer worker, but now I've just discovered I'm not. So it's kind of a bit weird identity from an identity perspective, but hey. So I noted, I was really glad, Helen, when you stopped and kind of shared with us your definition. It seems that the definition of peer worker is in relation to care. Obviously, there are lots of other work that goes on in the trust beyond literally one-to-one care. And if we really are co-producing, which, that word gets bandied around a lot, then, should it not be that in every aspect of the trust's operation, that lived experience should be informing all aspects of its work? So, my roles as a co-production consultant, which is sort of restricted to psychology a bit at the moment, but I work into governance and strategic groups, for example, the Clinical Effectiveness Board and the Sheffield Psychology Board. So my hope is that we might be able to, and my question is, do we have a vision for the lived experience workforce that includes input into service design, includes governance, includes strategic direction, and rather than, I feel that there's something about limiting it to care that means we can be very clear, and that's very helpful. But I feel this is an emerging workforce that needs roles all the way through the organisation in the way that, you know, I don't know, other workforces have come historically into the mental health system and established themselves. And it feels like we're doing this very much from the bottom at the moment, and, you know, from a position of kind of quite low bands. And like, who's supervising us? Are we not supervising ourselves? Like, that would be, I would like to see us to have some professional leadership in the way that psychiatrists and psychologists have professional leadership, because the emotional burden of like the work that we do is something that you aren't aware of unless you've done that yourself, you know. So that would be my sort of bit of a question, bit of a comment, bit of a hope, really.
Yeah.
Go
Sorry,
on, Mike.
No, I was just going to say that this is one of my main difficulties. It was when I started, you know, because we're very much supervised by, like, you know, the psychology team, and, you know, they're absolutely, you know, really, really good. But I think the problem is when I first kind of came into my role, they didn't really know what I did, and no one in the team really knew what I did. And then I didn't really knew what I did. So yeah, completely. And I think what can happen sometimes, in fact, quite often, is, you know, that the kind of peer workers all on the same band can become sort of the line managers to each other, because, you know, when someone new comes into the role, no one else knows what, you know, we do other than each other. So then, you know, that's who we end up like shadowing and stuff, the other peer worker that's already there. So yeah, I completely understand what you mean, like the kind of need for some sort of structure and like a kind of supervisor peer role, stuff like that. I think that would be helpful with the progression as well. But yeah, anyway, that's my kind of comment too.
Yeah, and I was just going to echo, yeah, I think what you said, Jo, it's great. I mean, today's session is specifically about peer workers. But yes, we acknowledge there's two things really we acknowledge, I would say. One is that within the service user engagement group and the engagement expert by experience strand of that work, we acknowledge we talk about experts by experience, and peer workers are one type of expert by experience. So another thing that we have been talking about is all these other people who are in roles like yourself that are quite similar to peer worker. There's pros and cons, and yes, some people, there may be people in the trust who are working as peer workers, but they're not called peer workers, and because of the national agenda at the moment, that is quite an important distinction. So we do need to make some decisions and work with teams around whether or not people are peer workers, whether or not they want to be, whether they are. So we need to get some clarity, and that's something we are working through. Other than that, I totally echo everything you said. There are no high-banded people in intentional lived experience roles in this trust anymore. There have been previously, and I'm with you on trying to get us all get those posts there and have more leadership. So just, yeah, keep on doing what you can. I'm doing what I can. But yeah, thank you. I think you were very articulate, Jenny. It's really helpful. Kate, you've got your hand up.
Yeah, thank you. I've applied to be a culture champion. Haven't heard anything yet. We'll hear by the end of the month, hopefully. You mentioned about organisational culture to empower peer workers to thrive, which obviously complements one of the trust values of ambition. There's been an overview here, but can you be a bit more specific about and actually name what some of the barriers and discussions with regards to adopting and integrating peer support workers have been? Just obviously, if I am successful in this culture champion role, I want to be able to discuss those things and have quite an open forum about it. So that's me. Thank you.
Yes, I would say that sending out the culture champion thing widely to service users, that is also something we've done on the back of this work strand to make sure that it's hopefully got out to service users, to volunteers, to acknowledge that you're exactly the kind of people who we need to be as our culture champions as well. So that's one of the links. So some of the challenges we've had historically are that other staff, professional staff, have felt that peer workers is not the right thing to be doing in mental health. So the reasons for that come from a good place, but they can be seen as paternalistic because, as I think Joe said, there's a huge emotional burden to this kind of work. So you're putting somebody who is vulnerable into a job that you know is vulnerable. You know, mental health staff are widely acknowledged as finding the job quite stressful. So it comes from a place of protecting people who are our service users and thinking that, oh no, this job's too difficult, we don't want people to do that. Possibly it comes from a place of threat. There's certainly some stuff in the literature that, oh, well, what's my role as a health professional? What have I had all my training for if actually a peer worker is more effective than me? So we need to be honest about that. And I think some uncomfortable, the them and us thing, it exists in mental health services, it exists in society. And peer workers, it's called the liminality, isn't it? It's challenging that it's easier in a way to have firm boundaries, isn't it? I'm a health professional, I'm well, nothing wrong with me. You're a service user, I'm here to help. That kind of narrative is really easy and simple to work with, but that's not the reality. We all experience mental distress at different times in our lives, and so it's a threat, and it's a challenge, and there's, I think, people trying to navigate around that and around. Helen touched upon confidentiality. Everyone has the same issues, but I think there's been concerns, and there's also been concern about raising those concerns. So one of the things we're trying to do is talk to supervisors, let people say when it goes wrong. You know, it's gone wrong, or how do I do it? How do I have this difficult conversation? Where are the boundaries? So I think it's acknowledging that this is a change to services. Let's not beat people up for voicing those opinions, but let's find a way through it to change and to recognise.
And actually, I guess the role of a peer support worker would bring immense, I've written the word flavour or complement, as opposed to a replacement of what's already in place. So it's quite exciting, I think. Thank you.
Could I also just add there what I found quite interesting? Obviously, I've come into the work, you know, kind of later on, but I think that sense of sometimes, you know, who is potentially asking the question, or who has that ability, or, you know, is seen as if we use the right person to do that asking. And that's really interesting, you know, that people feeling a sense of, yes, this is part of my role to actually go and ask specific questions or support, you know, say if it is support services, to maybe learn more about peer support and understanding, you know, why a peer support worker would be helpful to be employed and how to do it in a way that works, you know, well. I'm also aware, Joe, you've still got your hand up. Is that intentional, or is that an old hand? You're on mute. I'm assuming it's an old hand.
Lynn, have you got your hand up?
Are you on mute, Lynn? Oops.
We can't hear you, Lynn.
No. Are you able to maybe put something in the chat, Lynn, if you'd like to?
And I'm just wondering whether, I kind of feel I've been speaking a lot today, whether Rachel or Helen wanted to come in and kind of respond to any of the questions we had earlier, or any more reflections on the process of how far we've got, on how far we've still got to go. I'm conscious that we're coming to the end of the session, but
no, I don't think I don't think you need to worry about speaking a lot, because you know what you say is good. But no, I just think it's so nice to sort of be, I know it sounds really cheesy, but to be able to like kind of have a voice and be able to kind of say what's going well and not, you know, what's not been going so well, and actually to, see things starting to happen. So yeah, like Gurka and Laura and stuff have just been really, really instrumental in kind of, keeping this all going. So, just really grateful. So thanks.
Helen, any final thoughts from you?
No, I think we've virtually covered everything, and I agree entirely with what Kate and Joe have been saying about the structure and the role within SHSC and how we can take that forward, kind of thing. So yeah, I think that's something we're going to be working on going forward, definitely.
Thank you, Helen. Nicola, you've just put your hand up.
Yes, I have. Thank you. I'm a service user in the EIS service at the moment. I've just been sat here listening. Basically, I had a support worker before I got in the early intervention service, and my support worker was from Mind, and he helped me tremendously with the baseline things. So when I became ill, I had to leave work, so I needed to apply for benefits. I had to have assessments. My physical health was bad, and he just helped with my day-to-day things, or because I saw him every week by week. I had that much going on, and it was like crowding my brain. And if it wasn't for him, I wouldn't have been able to make the next step in my recovery, which was CBT and medication and things like that, because he himself had been a service user, and it was nice that he could say to me, give CBT a try, it does work, you've got to do this. Just knowing that every week I had that person checking on how I was, you almost feel like someone's got you, kind of thing, while you're falling. And I just wanted to say really how much they helped me, and how that can then help all the other people in the service once you've got that flat line, that baseline. And that's it really. Thank you.
Thank you very much, Nicola. Thank you for sharing that. And I think that's a really nice point, actually, to finish the session. I'm aware it's 1 o'clock, so I just would like to say thank you to everyone who's come along today, and hopefully see you later in a week. Bye.
Bye.
Bye. And thanks, Nicola, for saying that. That was a really lovely thing to say. So
you're welcome. Thank you. Bye.
Bye. Bye.